everyone is doing well. It is the weekend, TGIF. Yes, I'm so happy it's Friday. I know it's been a while since I've been on here. I've been kind of like going through the motions again with the anxiety, the health anxiety. It's not as bad as it was back in April. And in addition to that, I'm PMSing. So my moods are like up and down, emotional, you know, agitated. All of you women can understand. So just to jump into it, I've been experiencing lower back pain. And it's been kind of on and off, so it's been kind of chronic, but it's positional. It normally happens when I'm sleeping on my stomach and of course around my cycle. So I have a condition called Diastasis Recti, and it's when the abdominal muscles separate. So this happened to me because of my pregnancy, my last pregnancy 2 years ago. I was carrying her. She was really big, and the way that I was carrying her, she was actually overlapping my pelvic bone. It's hard to explain, but I have pictures, and if you could see where, you know, like the way that I was carrying her, how it just looks like it was just slumped over. There was no support for my belly. However, as a result of that, that's what I have, diastasis recti, and I believe that I have a little bit of a hernia too, is when your intestines poke out. So I went to the doctors the other day, and my physician, she checked it. She said, yeah, your abdominal muscles are definitely separated. And I'm like, yeah, it's causing a lot of issues. So diastasis recti can, because your core supports everything, your back. So my lower back is what's giving me the issues, and it causes lower back pain. And in addition to that, it can cause, you know, constipation, loss of bladder control, and that's something that I really suffer from after this third pregnancy. Like, I kind of have to like stop, sit down, or like kind of hold my legs really tight when I sneeze. If I don't, I will have leakage. Never used to be that way before my third pregnancy. The constipation, that is real. I drink a lot of fluids, and I try to pack myself with fiber. So I shouldn't really have an issue with, you know, my stool being hard. But I still have issues with like the constipation. I have to kind of like guide my rectum and my colon, you know, guide it through pushing the feces out. So yeah, but in addition to that, the anxiety comes along with that. I'm on Google, which I shouldn't be. I don't advise anyone to use Google. You should always seek a physician. However, I've already sought professional advice from my physician, and she doesn't think that there's anything severe or anything to be worried about, because it's not all the time. It's positional, and it happens sometimes. It comes and goes, and I'm like, oh my God, is it cancer? Is it a tumor that is sitting on my sciatic nerve? And I'm like thinking of all of these things, and that's where the anxiety comes from. Like, I gotta stop, you know, going off of the ledge, you know, so quickly, because there are so many other things that cause lower back pain. And I just been trying to meditate, and that really works. Guided meditation for health anxiety on YouTube. Another thing is deep breathing. That normally helps me. And just trying to relax and maybe watch one of my TV shows that I like. I'm so busy, so I don't really get a chance to. But saying all of this to say, I gotta get it together, because school is next month. My semester, my third semester, I take microbiology. If you all don't know, I am in school trying to obtain a master's in nursing. So I have to have these prereqs first. I already have a bachelor's, but I have to have the prereqs in order to apply for the program and then get accepted. So I'm like 2 classes away, nervous. I know the program is very intense, but I can do it, you know. If I can do it, you can do it too. So, you know, that's just what's been going on. The anxiety, and then the mood swings from the PMS. I have really bad PMS. I have the bloating, I have the, you know, the painful breast, I have the mood swings, up and down, you know, the food cravings. It's like being pregnant all over again. But I'm here, I'm getting through it. You know, as you can see, deep breathing, meditation. I have a lot of support. My friends are also there for me to talk to, you know. So the health, the anxiety, it comes and goes. You just have to know how to manage it. And, you know, I'm working on that. It's not as severe as it was in April, so I'm good. But it's real, you know, being afraid and being so like obsessed with your health and wanting to be healthy and not wanting anything to be wrong. And it's like, you know, I'm 33, I'm getting older. I know that things are gonna come down the line, but that's why I gotta get back into being fit, and exercising, and changing my diet a little better. So I have a lot going on, but I hope you all have a great weekend. And remember, if I can do it, queens, you can do it too.